Renal hilar fat connects with the perirenal fat, and the purpose of it is to probably allow the renal pelvis to distend as urine is produced and stored in the pelvocalyceal system. Some patients who have extrarenal pelvis do not have prominence of the hilar fat. As a matter of fact, if we see excessive fat within the kidney of a patient with extrarenal pelvis, we must suspect a pathological condition. Excessive fat in the renal sinus may be an anatomic variation, but also may be seen with inflammatory and other processes of the kidney. This is a nephrotomogram of a normal patient who has abundance of peripelvic fat at the level of the renal sinus. This is a perfectly normal finding. On a cast corrosion of the left kidney, we photographed the hilar portion and note the space between the renal pelvis and ventral to it, the branches of the renal artery, and ventral to the artery, the renal vein. In other words, this patient had an intrarenal pelvis with normal fat surrounding it. This is a left kidney of a 20-year-old woman who had lost weight considerably and presented with hematuria. Note that there is a filling defect in the upper portion of the left renal pelvis. But also note that we do not see fat surrounding the renal pelvis. A nephrotomogram of the left kidney shows a discrete filling defect or a lucency in topography of the left renal pelvis at the junction of the left renal pelvis with the infundibulum of the upper calyx. Differential diagnosis would have to include a radiolucent stone, a benign or a malignant tumor. A selected left renal arteriogram shows that there is a branch of the left renal artery that indents the upper portion of the left renal pelvis. So therefore the filling defect was due to extrinsic compression from a normal vascular structure, in this case a branch of the left renal artery. What has happened in this lady was that the loss of weight and the loss of fat at the level of the left kidney allowed the proximity of the peripelvic vessels to the renal pelvis. Her hematuria was due to a cystitis. So one differential diagnosis to entertain in individuals who have lost weight or have very little renal sinus fat in the differential diagnosis of a filling defect at the level of the renal pelvis or infundibuli or calyces may be the absence of fat and indentation of these structures by a branch of the renal artery or of a renal vein. Excessive fat due to a pathological condition is noted in this first case, who had a cyst in the upper pole of the kidney and a cancer in the lower pole. This other patient with abundance of fat had bilateral renal papillary necrosis. And our last case is excessive fat in a patient who had angiomyolipoma. So fat is a normal finding or can be abnormal in the presence of benign and malignant conditions of the kidney.